Hi, this is Emilio Fentanes with the First Committee interviewing the prominent SCCT members, and we have the pleasure of having Dr. Ahmad Slim with us, who's happy to answer a couple of questions for us. Dr. Slim, how do you perceive this meeting will affect your clinical practice?
The beauty of SCCT annual meeting is your ability to connect with multiple people, communicate and learn, and the lessons learned as well as the literature and the research provided drives a lot of our day-to-day practice. So it's almost mandatory for anyone who has interest in cardiac imaging to attend SCCT to be able not only to keep up with the newer technology, but to understand the implementation and how to build a program that's efficient, cost effective to their own practice, day-to-day practice.
Speaking of recent implementation, the SCCT in collaboration with the ACR and the Society for Cardiac Imaging recently published the CAT RATs. How do you expect that this expert consensus document will have impact in clinical practice?
The standardization of care is driving a lot of things in today's market, if you want to put it this way. There are a lot of changes to the healthcare system, a lot of changes to the reimbursement system, and we need more and more guidelines that are not just focused on the clinical aspect, but the standardization of care, standardization of language. So not only our patients understand what is going on and what to do with that result, but the different payers from CMS to private payers can understand the different language that we speak, and we'll be able, moving forward, to implement the research into real life using standardized language. And in a way, we'll be able to explain to the person who is helping us provide great clinical care to the patient why we need to use CT as an emerging technology by just speaking a language that they can understand.
Excellent. In your opinion, how are coverage policies being driven by cardiac CT research?
Um, CT has been leading the way significantly in changing the way that we understand clinical trials and outcomes. And the beauty of having the Society of Cardiovascular CT behind us as imagers is over the years. They took a lot of the research that's being generated yearly and utilizing it to go back to healthcare coverage entities and cover more and more for our patients. And I can tell you over the last decade, there has been significant change across the map in the US as far as coverage, just driven by the clinical trials and the outcomes that cardiac CT has provided. And that's something that the society as a whole should be proud of.
Excellent. What are some of the early practice opportunities in cardiovascular CT?
There are a lot of emerging practices, big practices that do not have cardiac imaging capabilities. And a lot of the newer fellows that are graduating, especially with expertise in cardiac imaging, they find themselves leading the way in building the practice focused on patient-centered care and imaging for the practice. It is pertinent, and we see it a lot. These fellows, when they come to SCCT and other meetings, not only they're able to connect and communicate with people who has done this before, and they can learn the lessons learned and the mistakes from them, but able to take home different programs that they can apply in that newer practice, so they don't have to reinvent the wheel in a sense. When a society is providing them with a lot of the tools, not only to build the imaging programs, but to build it the right way from the ground up.
Excellent. Well, Dr. Slim, what is the most exciting change in healthcare policy in its development that you have seen so far?
Um, as a system that's in infancy, a decade is not a long time in the field of cardiovascular disease. We've seen leaps and bounds as far as coverage, and that's truly driven by everyone. Every cardiac imager who contributes, who generates research, that research provides the society with tools to go back to the healthcare coverage. And with the changes currently coming through as far as healthcare payment and reimbursement, CT is becoming more and more efficient system to provide a great care with minimal cost impact on the society as a whole. With one of the few imaging modalities that actually provide a long-term warranty period for those without disease, and that is a lot of reassurance that our patients are asking for on a regular basis. So to be able to provide them cost-effective care and to see a lot of the HMOs and the CMS starting to cover the majority of indications for cardiac CT, driven by the hard work of everyone, it's impressive and it's promising.
Excellent, sir. Well, thank you for your time, and we appreciate all of your expertise, and
Thank
thank
you.
you for this interview.